Recruiting and retaining patients has been an issue for most clinical research sites since we can all remember. What are we doing wrong? And what can we do to improve patient recruitment? Are we moving fast enough and following the newest trends, or are we getting left behind? Evolution towards digital patient recruitment leads to new problems for the industry. One of the positives and the negatives at the same time of this new digital method is that their ability to generate a lot of referrals. For instance, our Pro package at TrialJoint can produce over 80 referrals in a very short period. This fantastic turnaround can often be a burden, the negative we mentioned above, and the large cost center for the research sites that have not yet adapted to handling this larger volume. More referrals means more phone calls and more uncommitted patients. Wait, did we say uncommitted people? Yes, we did. People can often sign up for a study without much thought. That's the way of the internet. Think about how easy it is for you to fill out a form in the first place. Sort of like the one-click buy to purchase on Amazon. Purchase we often regret later on, ultimately. Well, the same thing can happen when you ask patients to fill out a form and sign up for a study. Unlike in a private practice, a patient is less bound to your research site. This absent leaves a gap which you have to fill ultimately. That missing component can be anything from trust, authority, influence, to obligation. Don't sweat it though. It's easier to do all that than you actually think. Ask any clinical research expert and they'll tell you that the patient retention challenges can sometimes be even bigger than recruitment. Focusing only on recruitment without having a long-term plan to nurture these patients is a mistake that most research sites make. So we're not surprised when we look at the large patient dropout rates. Evolution towards digital patient recruitment leads to new problems for the industry. One of the positives and the negatives at the same time of this new digital method is that their ability to generate a lot of referrals. For instance, our Pro package at TrialJoint can produce over 80 referrals in a very short period. This fantastic turnaround can often be a burden, the negative we mentioned above, and the large cost center for the research sites that have not yet adapted to handling this larger volume. More referrals means more phone calls and more uncommitted patients. Wait, did we say uncommitted people? Yes, we did. People can often sign up for a study without much thought. That's the way of the internet. Think about how easy it is for you to fill out a form in the first place. Sort of like the one-click buy to purchase on Amazon. Purchase we often regret later on, ultimately. Well, the same thing can happen when you ask patients to fill out a form and sign up for a study. Unlike in a private practice, a patient is less bound to your research site. This absent leaves a gap which you have to fill ultimately. That missing component can be anything from trust, authority, influence, to obligation. Don't sweat it though. It's easier to do all that than you actually think. Ask any clinical research expert and they'll tell you that the patient retention challenges can sometimes be even bigger than recruitment. Focusing only on recruitment without having a long-term plan to nurture these patients is a mistake that most research sites make. So we're not surprised when we look at the large patient dropout rates. The process to make recruitment and retention easier is called a patient engagement funnel. A patient engagement is basically getting more patients engaged and involved in their own healthcare. How can we do that? Easy. This engagement funnel is an easy way to break that down. Let's start with the acronym ADA. Okay, let's move on. Wait, you probably want me to define that first, right? So ADA, A stands for attention. The first one is getting patients' attention. Sort of like how I got your attention by not defining ADA after I introduced it ultimately. And the second one, the I, is interest. Next, you have to build their interest to participate in a clinical trial. A good way to do this is by educating them further on their condition, on what a clinical trial is, and as well as what clinical trials you have going on currently. This step can be done through ebooks, videos, and articles. The D in ADA stands for desired. Since you've already educated the patients about their conditions and the need to get better, hopefully, you've started this stage of the funnel automatically. A patient will be curious about the trial because it's potentially the latest treatment option and also can help out with future generations, including their kids. The last part, A, is action. Don't confuse this item with them just filling out a form to express their interest in study. This stage is where the patients give you a call, complete the pre-screener, sign a medical authorization form, or even come into the actual screening visit. So after a patient expresses interest in a trial, get their email or phone number. This way, if you have either one and you receive their permission, you can start sending them general health information or even condition-specific information if they allow you to. What's more is that you have to do this all quickly, as quick as possible. Follow-up is key here, and do this immediately, otherwise your patient will forget and lose interest. Even the ability to email or even text can greatly benefit your automation strategies. Before I dive into automation strategies, I want to take a slight detour. The clinical research industry has not yet had to deal with the plights of sales, such as nurturing a lead, keeping a lead warm, and the larger volume of follow-ups as other industries have had to deal with up until now. Well, now it's time to adapt to the current ways of doing marketing. As you generate referrals online, you have to follow the trends of the internet marketing world. This is because you're now competing against many other companies and the noise that they're generating. So while your research study may be extremely important to them, and at 1 minute, another minute can show up where another ad shows up showing them 6 easy tips to lose that belly fat that may show up and ultimately steal their attention away from your study. Short and limited attention spans of customers have proven to be a really painful spot for marketers. Customers' attention is basically counted in micro moments which marketers have to catch and then use smartly. There are thousands of micro moments occurring every day each time a customer wants to search or look for something on their device. Unless this customer wants to find your website specifically, you'll need to have all your content and posts search engine optimized so that you increase the chances of customers stumbling onto your website while they're browsing for answers. To make matters worse, our internet generation doesn't have time to think things through. Instead, we look for instant gratification, so unless the user sees something that benefits them immediately, they're going to move on and look for something better. The way you ultimately combat this is by mimicking the marketing geniuses of the web, who have counteracted this short attention span by building funnels. They continually use emails, videos, articles to stay on top of mind and move people progressively through the funnel. Next, they're always creative and trying to get an edge on the competition. So ultimately do things that are unique and that no one has done before. Take a page from a software as a service application, a SaaS, one I'm sure you've heard of called Salesforce. They've built many funnels to get people to eventually subscribe to their software. They offer ebooks which they can download by filling out a form, or even sign up for a webinar by filling out the same exact form. Not only does this help keep a person's attention, but it helps build trust. A common saying in the marketing world is that it takes 7 encounters with your company before someone starts to form trust. For the second part of the discussion, I want to talk some more about automation practices. First of all, setting up Google or Facebook ads campaigns requires good targeting practices. When you're trying to recruit for more patients for your study, you'll need to target patients or their caregivers based on their condition. Ultimately, you have to look at their therapeutic indications, their location, age, gender, likes, and interests. These are the most important points that will allow you to form your target audience. However, depending on what you're looking at for, there can be many more things to consider. For example, if you have already an existing group of customers, in your case patients, you can create a lookalike audience on Facebook, or you can even target patients based on one specific like, whether that's a patient community group or another research center doing in your area. Doing these things will greatly increase the chances of your targeting reaching the right type of person. Aside from the importance of a well-structured targeting campaign, there are a few important metrics to consider when you're setting up your marketing campaigns. A great way to start off is by grouping your results into awareness, engagement, and conversion. To measure awareness, you may want to look at your number of followers, web traffic, and external referrals. To measure engagement, you'll want to look at the page view numbers as well as your visitors' reaction to certain types of content. This will give you an idea of what works and what doesn't so that you can adjust and update your content accordingly. And then you'll need to follow up with repeat site visits and the time that average user spends on your site, and social media shares, mentions, and email clicks that you have as your metrics. And finally, your conversion rate will have to be calculated based on the different preset completed goals. These goals can be anything from filling out a form, downloading content, to actual study registration. Setting all these metrics ahead of time together will help your targeting, and your regular observations will improve the success of your campaigns that bring in the patients that you need to recruit for your study ultimately. Digital marketing has taken over the world. In clinical research and in the healthcare world, this type of marketing is cost-effective and generates a lot of referrals. In most basic sense of the word, digital marketing includes search engine optimization, search engine marketing, pay-per-click advertising, social media marketing, content marketing, and lastly, email marketing. Of course, the list can go on forever. So when I say digital marketing, feel free to think outside of the box. SEO content, articles, interviews, podcasts, webinars, free ebooks, videos, video recordings. And furthermore, don't restrict yourself with just one platform. Create a website, landing pages for different conditions, show testimonials, reviews, success stories, use Google Ads, Facebook Ads, YouTube, Twitter, LinkedIn, SlideShare, Pinterest, and Snapchat. Go big! Appear on all the platforms to increase the chances of patients noticing you. This is how you create your patient engagement funnel and build connections and trust. One important strategy is to consider when it comes to social media advertising is influencers. These people or businesses who are well known in a certain industry and enjoy the privilege of having a huge number of followers. Besides, these are usually people who patients trust and respect, which means that they're going to most likely follow their opinion. Influencers exist in every industry. Using them can bring you great success. To strengthen up your success even more, make sure that the website has an amazing interface and provide an interactive, targeted, and personalized content. Customers are sick and tired of generic content. They want to see something personalized and targeted to their specific needs. And basically, as we said, instant gratification. Provide valuable content that's easily seen on your website and name it something like a free gift, a free webinar, or a free crash course on how to manage your diabetes. Nowadays, we want everything that's time efficient, served on a platter for us to easily reach. So make sure that your website isn't slow and too crowded. Another thing is to use subheadings, bullet points, and short paragraphs instead of large blocks of text. Nobody really has the time to go through a big block of boring text. So also you look at using infographics, videos, and tests and different types of hooks to grab people's attention ultimately. These so-called hooks are the things that are going to separate you from the rest of the crowd. So when it comes to search engine advertising, your best bet is to place ads with the help of Google AdWords. With the help of this tool, you can create lead campaigns which are keyword specific and search engine optimized. Doing this will allow you to target your group of potential participants in the most precise way. So also, don't forget about mobile phones. These are important. Nowadays, smartphones are a pocket computer, so all the content you publish on the internet has to be mobile optimized. Use this opportunity to create an app with free educational and informational content. Or why not create a condition-specific app that allows patients to participate in a community with their fellow patients. Another great mobile optimization option are pay-per-click mobile ads, as well as click-to-call advertising. Use your creativity and the possibilities are really endless. The next thing I would like to remind you of is the importance of emails. Once you've gathered a list of interested patients' emails, you can start checking in with them and gifting them some valuable content. You never want a lead to ultimately cool down, so get the leads while they're still hot and keep serving them content to keep them interested. A great thing to do is send personalized emails and give away free ebooks or webinars with educational content on the patient's medical condition. The goal of this is for them to see that you're serious and a trustworthy source of information. You can even take things up a notch and invite them to your research clinic for a free checkup. Nobody passes on an opportunity for a free checkup. Aside from marketing purposes, you can also use emails to send patient reminders or to double check and confirm appointment times. It's almost estimated that over 80% of the population uses the internet to research medical issues. So basically, the online world can be seen as a vast recruitment funnel, which is only waiting for you to take the initiative and find these patients. Online presence is a must-have nowadays. On the other hand, all of these marketing strategies require a great amount of media placement and planning as well as budget planning. You don't want to spend too much on the wrong type of advertising. This is an area where professionals can be of tremendous help, like us at TrialJoy. This media planning involves different areas such as targeting, scanning of the environment, audience types, type of content that works for specific audiences, analysis of the results, And for someone with no previous experience, doing all this can be time consuming and a headache. And not to mention, it may not be budget friendly if they don't do it right. So when in doubt, always seek help from a professional. Recruiting and retaining patients has been an issue for most clinical research sites since we can all remember. What are we doing wrong? And what can we do to improve patient recruitment? Are we moving fast enough and following the newest trends, or are we getting left behind?